We often think of health as being absence of disease, but we know that health is far more. In fact, health exists on a continuum with disease. So a lot of our work is focused on measuring precisely what it means to be healthy, with the idea being that if we can measure health, then we can do a better job of managing it. So what does that mean? So in part, it does mean collecting so-called multi-scale omics, your genomic information, your microbiome, your metabolome. But the honest truth is that there's not a whole lot we can say with that data today. That's half the story, but in order to make all that data relevant, we need to look at the other side of the equation, and that means tracking outcomes. How do people feel? How do they function in their everyday lives? And we also need to be tracking and monitoring healthy lifestyles and behavior. We're increasingly becoming aware that behavioral factors are important determinants of overall health. In fact, behavior contributes something like 40% of premature death. That's more than genetics, that's more than healthcare-related factors. So it's really important to be able to measure what healthy behavior looks like. So to that end, we're looking at monitoring sleep, not in the lab, but out in the real world. As you probably know, there are plenty of consumer devices to help you track your sleep, and we're putting them to the test. We're looking at all of them. We're seeing how we can do better. We're seeing what they're useful for. We're also looking at other factors like diet and nutrition. It's surprisingly hard to measure what people are putting in their bodies. And we're working on developing an app, for example, that lets you take photos of your food and your drink. And it seems that I think it's cropping up everywhere. I think it was just on an episode of Silicon Valley a couple of weeks ago. But in all seriousness, if you really want to help people improve their lifestyles, you have to be able to start by understanding what people are doing.